So what is angina? Angina, or angina, if you want to be weird, means strangling. And specifically, it means the strangling of the heart. And that strangling comes from insufficient blood flow. So to put it together, angina is pain caused by insufficient blood flow to the heart, otherwise known as cardiac ischemia. And when so anytime there's increased oxygen demand at a tissue, the demand for blood increases at that tissue because oxygen is carried in blood. So angina, also known as angina pectoris, is chest pain that is felt when blood flow is impaired in a artery that supplies the heart. Angina is ischemic pain. So remember, the word ischemia has this root word, heme, in it. And when you think heme, you always think blood. So angina is that strangling due to ischemia. It's caused by insufficient blood flow to the heart. This means that myocardium, which is heart muscle, is not getting enough blood flow. And this insufficient blood flow could come from three main causes. There could be an obstruction in the artery. That could be from a plaque, a clot, whatever, a tumor. Kind of rare, but you could have a spasm of a coronary artery. That would be like an inappropriate constriction of an artery. Or you could have severe hemorrhaging of a coronary vessel. So if you have an artery supplying the heart and it has a hole in it, or it's ruptured, you have all that blood spilling out of it, it's not going to get to the heart. So ischemia, and this is just a quick point before we proceed, ischemia is not hypoxia. These are two different words. They often get interchanged, but there's distinct differences between them. So ischemia has to include hypoxia, but hypoxia does not have to include ischemia. So just remember that ischemia has that heme in it, right? It denotes insufficient blood supply to a tissue. Hypoxia has two words in it. It's hypo, which means low, and ox, which means oxygen. Hypoxia is low oxygen. So in an ischemic environment, there necessarily has to be hypoxia because blood carries oxygen. But in a hypoxic environment, blood flow could be completely normal. So can you think of a condition where blood flow is normal, yet the patient suffers from hypoxemia or low blood oxygen? Well, if you said anemia, you were right. Because a patient could have totally normal blood flow to their tissues, but they still maintain a low saturation of oxygen in the blood because they have a problem with like an iron deficiency anemia or some sort of anemia where blood saturation is low, or oxygen saturation is low in the blood. So here's this is a quick image of cyanosis. That's the medical term, which means blue, because look at the foot is blue because it's choked of oxygen. And in this case, it's chokes of oxygen because of ischemia. It says here that this is the right foot, and this is distal to the occlusion, which is caused by thrombosis, which is a blood clot in the right leg. So the blood clot's like somewhere up here, and the reason this is blue is because of ischemia. And so there is hypoxia due to ischemia. But the first main thing is that there's insufficient blood flow to the target tissue, and it's going to turn blue. So the next thing to talk about is cardiac workload. So why does your heart rate increase when you run? And also, why does your respiratory rate increase when you run? Well, there's an increased oxygen demand, right? So the demand for blood increases because oxygen is carried by blood. So when you're running or you're physically exerting yourself, your cells have an increased demand for oxygen because they have to undergo cellular respiration more. And remember, cellular respiration takes in oxygen, breaks down glucose, and then puts out water and carbon dioxide. So when there is increased oxygen demand, the demand for blood increases because oxygen is carried by blood. So your heart rate increases so that your heart can pump out more of these red blood cells to your body. And your respiratory increases so that now that you have an increased blood flow, now you can pick up more oxygen than you could have normally. So think of red blood cells as pickup trucks for oxygen. Your heart rate increases so that more red blood cell trucks move faster, both to deliver O2 to working tissues and to remove CO2 from tissues. So we need blood to supply, first to supply tissues with oxygen, glucose, and electrolytes. Remember, electrolytes are things like sodium, potassium, and calcium, which are really important for resting membrane potential and depolarizations, things like that. But you also need blood to wash away the products of cellular metabolism, like CO2. So that's also why you breathe harder when you run. Now that you're working harder, your body needs more oxygen in order to sustain more aerobic metabolism, like the Krebs cycle and electron transport chain. And when you have increased cellular metabolism of glucose, you're going to have increased oxygen demand. So physical exertion, again. Physical exertion increases cardiac workload. And when cardiac workload's increased, it's not so much, you're not thinking about the other tissues that need oxygen. You're thinking about the heart itself. Its tissues, its muscle, needs more oxygen. So if the heart is working harder, even if it's your legs or something that's working out when you're running, even if it's because your leg muscles need more oxygen, well, your heart now needs more oxygen. Anytime heart rate increases, cardiac demand for blood increases. So when the body's undergoing physical exertion, the heart beats faster to deliver more blood and oxygen to productive tissues. But you need to realize that increased heart rate means that the heart itself is working harder and it needs more blood as well. So if the blood demand of the heart is not met, you'll have angina. So once more, angina is the pain felt during cardiac ischemia, and that's angina pectoris. It's pain, chest pain. So here's a nice picture here that's showing atherosclerotic plaque buildup, and this is diminishing blood flow to the heart, and the person's hunched over because they're in serious pain, and that's what angina is. This guy looks pretty fit for having angina. It's probably not going to be your typical patient. He looks young and healthy. So in the lectures to come, we're going to talk about 3 types of angina. That's stable, unstable, and one called variant angina, or Prinzmetal's angina. And those are going to be covered in subsequent lectures. Finally, I'm just going to briefly introduce the topic of nitroglycerin, which is a common pharmaceutical intervention for angina. And what nitroglycerin does is it causes dilation of blood vessels. So you'll see in the top picture, you have these 2 blood arrows, and they're trying to get around this piece of plaque. And you'll see that the blood is having to slow down to go around it. In the bottom example, we have a dilated vessel. And so what happens here is now you have more room for, now both these arrows could probably fit up here. So that's what nitroglycerin does, is it increases the size, the radius of a blood vessel. And this relieves angina by increasing blood flow. It also decreases the amount of blood returning to the heart, and that allows preload and afterload to decrease. So in short, the work of the heart decreases thanks to nitroglycerin. And I'm going to cover preload and afterload soon, so don't worry about that. And if you want a refresher, just look at the cardiac physiology lectures I have. And sometimes patients can have other complications that can damage their blood vessels, something like poorly managed diabetes, or which would be like chronic hyperglycemia, for instance. That can cause so much tissue damage to your blood vessels that the patient's vessels are somewhat broken, and they can only inadequately vasodilate. So this inability to dilate will compound on the already reduced blood flow. So ischemia is a very common problem for your older aged diabetic patients, and especially those who are older and have had poorly managed diabetes for a while. So here's the credits for the image, and I'll see you in the next lecture.